Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Risperidone. Its brand name is Risperdal. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We're going to start by talking about how risperidone works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe risperidone. We'll then talk about examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does risperidone work? So risperidone is a selective monoaminergic antagonist with strong affinity for serotonin type 2 receptors. It has weaker affinity for dopamine type 2 receptors and moderate affinity for alpha-1 adrenergic, alpha-2 adrenergic, and H1 histamine receptors. In terms of indications or reasons we would prescribe this medication to a patient, we often see this medication used in bipolar 1 disorder. We see it used to treat schizophrenia. It can also be used to treat the irritability associated with autistic disorder. In terms of contraindications, the only real contraindication here is if a patient had a hypersensitivity to risperidone, paliperidone, or to any other component of the formulation. Now what about dosing with risperidone? So in bipolar disorder, if they were using the intramuscular injection, they would typically use 25 milligrams intramuscularly every 2 weeks. The maintenance dose was usually between 37.5 and 50 milligrams intramuscularly every 2 weeks, and the maximum dose in this situation would be 50 milligrams intramuscularly every 2 weeks. If they were using the oral tablets, initially they would use 2 or 3 milligrams orally once daily, and then they can increase the dose under the direction of their physician, but the dose would typically not exceed 6 milligrams per day due to a lack of clinical trials in doses over 6 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using risperidone, so I'll go over some of those here now. 1 to 4% of patients may experience a rash, while 8 to 21% may experience constipation. Diarrhea may happen between 1 and 8% of the time, and excessive salivation may happen 1 to 10% of the time. 10 to 25% of patients may experience vomiting, and 4 to 16% may experience dizziness. 6 to 28% of patients may experience Parkinsonism, and sedation may happen 5 to 63% of the time, a wide range there. Now, anxiety may happen up to 16% of the time, and some other side effects that may occur are blurred vision, weight gain, nasal congestion, or a pain in the throat. Now, some more rare but serious side effects would be hypothermia or a prolonged QT interval. That's all we're going to talk about today with risperidone or Risperdal. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.